Let It Heal Live. My name is Shannon Burnett. We are missing Amber Korbkina today. We were hoping she could Skype in, but it doesn't look like that's going to happen today, but that's all right. We've got a great lineup of guests today. Today our topic is arthritis, and the reason we wanted to talk about arthritis and do a show on it is there are a lot of people out there that are suffering from arthritis and don't realize that there are a lot of other options out there besides just surgery and the pharmaceutical route that can help to bring about more mobility, and basically get your life back. So we're going to be looking at a lot of those different options. We're going to be talking to a couple of professionals that deal with arthritis clients on a regular basis, and we also have someone calling in who herself is dealing with arthritis, both rheumatoid and osteoarthritis, which is quite a difficult journey. So our guest that we have today, we have Russ calling in later this morning from Fit with Fuss. He was here with us last week giving us some tips on nutrition and fitness having to do with cancer, and today he's going to be doing the same thing for us for arthritis. We have Debbie O'Brien calling in or Skyping. We're still trying to work that out with her. We'll see how that goes this morning. And she's been a long-time sufferer of arthritis. She's going to tell us her journey, the different things that she has done to get her where she is today, living a wonderful lifestyle. And our first guest today is Connie Pugliasi. I know I'm going to say it wrong, Connie. I'm so sorry. Connie is a doctor of naturopathic medicine, and she started out as a kinesiologist. She also does bone. She's a bone instructor, woman of many different talents, and I'm so glad to have you here with us today. So we're just gonna dive in because I don't have Amber to do my normal repertoire here with. We'll dive in for a little bit. We have so much to cover today, and I'm so excited to do it, to give some information out there to people that don't otherwise have it. So, Connie, why don't you start telling me now? How did you get into doing what you're doing?
I think it was mostly inspired in my education at York University and taking the phys ed program there. I learned a lot about how nutrition itself can be so powerful, a powerful tool in changing the physiology of the body. And so that got me really intrigued. And I went to see a lot of alternative therapists at the time. I was visiting a chiropractor, seeing a chiropractor regularly, and that got me even more interested in the alternative healthcare field. And so from then I was searching. Searching about becoming a registered dietitian,
right.
But that wasn't enough for me. And chiropractic wasn't enough. I wanted the whole package. And so a friend of mine told me about naturopathic medicine, and I looked into the college and I said, wow, I've never heard of this before. It was fascinating to me, and I said, that's what I want to do, and went into naturopathic medicine. In my 4th year of study, I met Manon Bolliger, Dr. Bolliger,
wonderful woman,
who's now in British Columbia, and she introduced me to the Bowen therapy. And I went on to learn that in my 4th year, and it's become about 50% of my practice. So it's been a great adjunct to naturopathic therapies.
Absolutely. Yeah, once you get into the alternative healthcare, you're kind of hooked. It's the same with Bowen. I tried to avoid it for a little while, but you can't deny the success rate that's there.
Exactly.
It's incredible. Okay, so we're going to talk about arthritis today. So basically, why don't you, I'm going to play a little dumb here today, and so why don't you basically tell me what is arthritis when it comes down to it? What is this condition?
Well, arthritis, in the word, it's inflammation of the joints.
Right.
Various joints. There's different types of arthritis, as we know, rheumatoid arthritis, osteoarthritis, there's even psoriatic arthritis and gouty arthritis. There's so many.
So many different types.
The most common one is probably osteoarthritis. And the beginning stages, there is not really any inflammation, but the people do feel a lot of stiffness, morning stiffness specifically. And so from there, then the joint cartilage gets degenerated. So a lot of people call it degenerative joint disease instead of arthritis.
Got to put the disease label on it, right?
Exactly. So from there, then inflammation can ensue and lots of swelling. Obviously, pain comes from that.
Right.
The rheumatoid arthritis is more of a genetic link. It's related to autoimmune disorders. It's in that family. And so the body is basically attacking itself. And so we get the painful inflammation, and also joint destruction as well will come with that.
And rheumatoid arthritis is not just limited to the joints, though, is it? It can affect other areas of the body?
Well, yes. If you have true rheumatoid arthritis, it can affect organs as well,
yeah,
definitely.
That's very debilitating, very debilitating.
Definitely.
Okay, so yeah, we've talked about there are a couple of different types of arthritis, and there's even juvenile arthritis, too. It can affect children.
That's right.
And now, can children get both rheumatoid and osteoarthritis?
I think anyone can get either one. Osteoarthritis sometimes comes after
With age, older.
Yes, with age, overuse. And sometimes it can become from trauma if a child has had a injury.
Okay.
And the body hasn't healed properly, the osteoarthritis can develop from that.
Right, the swelling doesn't go down and then the cartilage starts to rub on itself.
Yes,
Right.
and it can even be caused by just a joint malformation, so a genetic, something that you were born with.
Okay.
So the joint is not formed properly, and so the cartilage doesn't work as well.
Okay. So how do you find out whether or not you have one of these types of arthritis? Is there, like, obviously there must be some symptoms you look for.
For osteoarthritis, it's mostly the morning stiffness that starts first, and then you get more of the pain and mobility problems, basically. You can see joint problems through X-ray and MRI.
Okay,
you can
so
get
there are tests you
confirmation,
can do to find out.
confirmation to see if there's any joint degeneration happening already. With rheumatoid arthritis, it's more something called the RA factor.
Right.
Rheumatoid factor,
Right.
RF. So that would be found in your blood. So that's the main diagnosis.
Right, that has to do with some of the antibodies being higher, and so they're looking for...
That's right.
Oh, okay.
That's right.
Yeah, I have seen a little bit of information on that. So now, all right, so say you get this diagnosis, right? You find out that you have arthritis.
Yes.
Most people are dealing with their primary caregiver, which is a physician, who then recommends either surgery, depending on how severe it is, or, the pharmaceuticals. And based on my clientele, I see, there's a nice mixture of the pharmaceuticals that, that will be prescribed. We have the combination of the NSAIDs and even different types of cortisone shots.
Yes, definitely.
Along with the opiates and their combinations. So this is where a lot of clients find their way to me. I don't know if that's the same
Definitely.
with you. And so I know a lot of clients out there are looking for some alternatives. And that's really what I wanted to talk about today. So what are some of the alternatives out there if you have a client that comes in and they're already on this nice mix?
Well, a
medicines?
general overview of all the different therapies that someone can use for treating arthritis can be stemming from homeopathy. You can start with that.
Okay.
You can treat it with Chinese medicine, which would be a combination of acupuncture and herbs. You can use nutraceuticals, so different types of supplements that will help to curb the inflammation. So that could be high-dose enzymes. That could also be different herbs, Western herbs instead of Eastern herbs. So Western herbs that can help with inflammation and pain control.
Okay, so what's the difference between Western herbs and Eastern herbs? Because you specifically
Eastern herbs are based on more traditional Chinese medicine or Asian medicine, and they are based more on a Chinese or Asian diagnosis. So one person can come in with osteoarthritis and they would have 5 different diagnoses five different people can come in and there would be 5 different diagnoses.
Okay.
And so that's basically the practitioner looking at signs and symptoms and looking at things like where is there more heat in the body or more cold in the body. Sometimes there's something called a damp invasion. So there's all different types of diagnoses, and so we would treat them differently with different herbs. So it's more of a very individual approach.
Okay.
Yeah,
that's good.
So other than that, in my practice, I would use hydrotherapy, which is the use of water, so hot and cold water, and Bowen techniques. So those are the more physical types of modalities that I would use. A lot of people would benefit from nutrition changes, diet changes, eliminating certain foods, which we'll probably talk about later.
Yeah, we're going to get into that later.
Definitely. And those are the main ones that I use right now.
Okay, we're going to get into a bit more detail of those. We're going to take a quick break first and see some of our lovely commercials, and then we're going to come back and we're going to talk a little bit more with Connie.
Fibromyalgia is a debilitating condition that affects almost 1 million Canadians today. If you have fibromyalgia, Let It Heal has a treatment that can help you. As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief from my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal or drop by their clinic in Burlington.
Do you suffer from back pain, sciatica, or other debilitating conditions such as neck, shoulder, or foot pain? Find the relief you're looking for at Let It Heal.
As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief from my pain, and after only a few treatments that let it heal, the pain is gone and I can live my life again.
Call Let It Heal or drop by their clinic in Burlington.